Hi, welcome to Healthy Living. I'm your host, Amy Bouton. We are here today with Dr. Rob Fauché. He is a general pediatrician here for St. Tammany Health System, and we're going to talk about a lot of things today. We're going to talk about pediatrics in general, his practice, but we're also going to talk a little bit about autism awareness because April is Autism Awareness Month. So we are so glad you joined us today.
Thank you, Amy. I'm glad to be here.
So tell us a little bit about yourself. I know that you are probably known by lots of parents in the community, but for those who don't know you, tell us a little bit about yourself.
Well, you know, I went to Holy Cross. That's a big thing in New Orleans area. Where did you go to high school? So I attended Holy Cross, went up through LSU, did my medical training out of LSU in New Orleans, and then went on to residency through University Hospital and Children's Hospital in New Orleans. Did an extra year at Children's as chief resident of pediatrics, and then went out into private practice, where I've been doing this for about 20 years now, 5 to 6 of which have been with St. Tammany.
Okay, and where is your practice located for people who might not be aware?
That is a great question because, you know, we were located in Covington and then Ida came through and destroyed our building.
Right.
So we are now transplanted back to Madisonville, which is kind of where we started on Highway 22. We have hopes within the next 2 years, though, to get a nice, beautiful building put where we were before and become just kind of an overall general pediatric center of excellence there, where we'll have more services and labs and that type of stuff that kids will need and make it easier for the parents that way.
Yes. So, well, that's good. Good to know. Good to know where you're located, where people can find you. Let's talk about the practice itself.
Okay.
So when we're talking about Autism Awareness Month,
yes,
we have some certified autism centers within some of our clinics here in St. Tammany Health System, and your clinic is a certified autism center.
Yes.
So can you tell people who are watching, what does that exactly mean? What did you kind of have to do to get that, and why? Why is it important to have that?
Well, it's important because we can't have children who come to our office with a diagnosis of autism get treated like all the other kids. They have certain considerations that you have to bear in mind. Most kids with autism are going to have some sort of need for order or just a regimen that they are comfortable with. So you can imagine if they walk into a waiting room, something like we all take for granted,
yes,
and there are crying children and there are parents telling their kids to do things and there's a TV on and all of these different things, it can be really off-putting for them. So everyone from our front office ladies to our nurses to our physicians went through this certification process. It was offered through the International Board of Credentialing and Continuing Educational Standards, and it's ICBCES, which is a lot easier to say than all of those words.
Right.
But what it did was it allowed us to do modules over a period of, if you added them all together, it's probably 18 to 24 hours of training, where we learn from behavioral specialists, physical therapists, psychologists, the ins and outs, to the extent we could learn in such a brief period, of how maybe to better approach those kids with those concerns. One of the things that we're enacting right now as a result of that is we are, with the help of a behavioral analyst out of Baton Rouge, we are putting together a little booklet that is based on a principle called video modeling. And it's all about having them be able to come into the office and provide them with this book, where it's basic pictures with very small captions underneath that tells them the process that they're about to go through. So the nurse, there's a picture of a nurse coming to the door to call you back. There's a picture of a nurse telling you, you know, we're going to do your weight and we're going to do your vital signs, because we feel that if they can get a little bit of a preemptive look at what's coming up.
Yeah, know what to expect when you walk through the door.
It's an easier transition for them.
Right.
And it makes it a much more pleasurable process for both the child and the mom or the parents. What we like to also make a note of is that we don't, even though we're certified for autism, we do not make the autism diagnosis. That sometimes is something that gets confused in the process. What our training is for is just better to be able to relate to those children and make it an easier process when they come in for their routine health care. To get a diagnosis of autism, we can help facilitate that. We can have them come in and discuss that, but it's not something we would do in the confines of our office or during a visit with us. For that, we would probably refer on to we have a nursing navigator in our office, where we would refer those parents to, and his job would be to look at what they're looking for as far as what kind of diagnosis they're considering,
Right.
what their insurance is, where do they live, and all of these different factors to best fit them into a place where they can go at the most convenient way, at the most economical way to get that diagnosis made.
Yeah.
Once that's achieved, then we kind of take it from there in their daily care.
Okay, so I want to just reiterate that when this autism certification it equips you and your staff with the tools to work with the families of autistic children to make their experience pleasant.
Exactly.
Because they have to come in for physical exams just like every other child, and they need their yearly interaction or more. And so it helps the parents and the child. But and you were talking about when a parent would like to seek a diagnosis or thinks that they might need one, that you have the resources to refer them to. But not necessarily make the diagnosis. So do you ever kind of work with parents and say, let's talk about what might be happening with your child, and how does that work? And what are some of the things that parents might look for?
Yeah, that's a great question. Every time a child comes in, at least in our office for a well visit, there is a questionnaire that they'll fill out of their child's development, where their milestones are, what they're doing, what they're not doing. It's usually given in the form of a little iPad questionnaire they do while they're waiting in the waiting room. It gets transferred to our medical record, and then we see it usually before we walk in the door.
Right.
So that would be my first go-to, would be, are we making our milestones? Are we where we want to be developmentally, and those types of things. Then you kind of get to the intangibles, where you go into the room, you talk to the parent, and a lot of times when we're dealing with autism, it may not be as simple as they're not meeting milestones.
Right.
It may be more of an intangible, they're not making eye contact, or when they're in the playground, they're kind of off by themselves. And I don't want to, saying these things, I don't want to give the general public concern that if they do have a child or a grandchild who has some of these things, that it is necessarily autism.
Right.
But we do look for those types of things, which then kind of points us in a direction. And I always tell my parents, don't get hooked up on, or hung up, I should say, on the diagnosis, the word autism.
Right.
How I tell them is that, every child's brain is different. And just like a computer, some computers work off of a keyboard and some of them work off of a mouse. And it just depends on how we need to know how that information gets into their brain,
right,
so that we can better adjust our approach to their education and their development. So that would be the first thing we would do, would be the questionnaire, talking to the parents. And then if we both came to a mutual understanding that, yeah, there was a concern what maybe we want to look into, that would initiate our process as far as getting the evaluation done.
Okay. So how do you think, since the certification came into being, how do you see that it has impacted you and your staff and your patients in a positive way?
I think I would like to think it makes them feel more welcome. And I think there are times for these parents and these kids where whenever they go into a new environment, there's always this angst of, is this going to be a meltdown episode, or is this going to be something that sometimes parents find embarrassing if they're in public and stuff that way? We try to look at it as we can minimize those concerns, because we are a little bit better trained to know how to approach them in a certain way.
Right.
And the saying that I have heard that I like the most is, when you've met one child with autism, you've met one child with autism.
Right.
Because they're all different.
Everybody's different.
Exactly. And in pediatrics, we do have the luxury of kind of knowing these kids and knowing these parents on a personal level. So from the time the ladies in front raise their eyes and see them coming in the front door, we know kind of how to approach that individual child. And so we try to just facilitate ease of evaluation. It helps the parents, it puts them at ease, it helps the kids. It actually helps the physicians too, because we're there to try to assess them, examine them, do those things. And it's much easier if they're more relaxed with the process than if they're screaming and crying and upset. So it helps everybody, not just, it's a little bit selfish for us, in fact, because it helps us as well.
Sure. Well, thank you so much, Dr. Fauché.
My pleasure.
This has been a wonderful conversation, and we look forward to many more with you.
Thank you.
You can find Dr. Fauché in Madisonville, and we will have all his details for you, so you can get in touch with him and make an appointment if you need to. So thank you so much. Stay tuned for our next segment. We're going to be meeting with Lori Cage, Executive Director of our St. Tammany Parenting Center.
Kids should be seen and heard.
At St. Tammany Health System,
Many kids are being treated like Well, kids, we're not little adults, you know.
They have the North Shore's first kids-only ER.
And ICU.
They even have a parenting center.
Kids aren't the only ones who need to go to school.
Together with their partner, Oxnard Health,
St. Tammany Health System makes it easy to be on our side. On this side of the lake.
Welcome back to Healthy Living. Right now we have with us Lori Cage. Lori is Executive Director of our St. Tammany Health System Parenting Center, and she is also a licensed clinical social worker. So thank you so much for joining us for Healthy Living today.
Thanks for having me.
You're welcome. So let's talk a little bit about the Parenting Center. It's you know, I hate to say it, but it's one of the best kept secrets, and we want to tell people all about it. So tell us what you guys do there.
And that is exactly what I say all the time. So we have actually been in existence for 35 years. So, and I've been fortunate enough to be there for 22 of the 35 years.
Oh,
so
wow.
It is a fabulous place to work. So we have the center itself that
Right.
parents and caregivers can come 9 to 1 Monday through Friday and play with their children. And then we also have interactive classes like Mommy and Me classes with bubbles and music and crafts. I always say we do a lot of fun things, but we're sneaking a lot of education in because they're learning those fine motor skills, they're
Right.
learning transitions. We also have professional staff available. I have a dietitian, counselors, social workers, all on staff that are available for somebody to ask a question. And we always have a lot of informal learning as well as formal classes. And
Right.
everything we do is evidence-based. I know nowadays everybody asks Dr. Google
Right.
and some of these blogs and things, and some of my staff is just horrified sometimes with the responses. They're like, why don't they call us and ask us? That's not right, you know.
Well, we want to know that. Anyone can absolutely call. Is there
Yes.
some kind of membership for the Parenting Center? How does it work?
Yes.
How would someone get involved?
So we do have a membership that we have you fill out a membership form. We have suspended the membership fee. We are about to re-implement it just to help cover some of our costs.
Sure.
So, but it's very reasonable, $10 a month. That includes all your play, all the parties that we do, the classes, and some special events that we do as well, field trips and things like that. And we offer scholarships. So I never want cost to be a barrier for anything.
Right.
I also offer scholarships for some of our classes that we do charge for.
Right.
We have an active parenting class that is 3 weeks long, it's 3 sessions. So it's a little more intense class, so we offer that. We also do CPR, and that's very important. We do both certified classes and uncertified. So we have a lot of like moms-to-be and grandparents that'll come
Right.
and still learn the choking and the CPR and the first aid and things like that, which is vitally important. And we also have babysitting classes for those 11 to 16-year-olds.
Oh, that's great. So when you're a certified sitter, you went through
Yes.
your class, basically.
Yes. Yes.
So you said moms to be, and that is important for moms to be to learn certain skills before the baby comes, or certain just techniques or tools, right, for
Absolutely.
parenting. So moms to be are welcome, correct?
Oh yeah, absolutely, absolutely. And we also offer a few classes for that as well. We have a boot camp for new mommies.
Oh, nice.
And a boot camp for new dads.
That's
So-
really good.
Yeah,
so everybody
you-
kind of gets on the same page.
Right. And I had 2 staff that had babies that they said, you know, you didn't really know what you didn't know.
Right.
until the
you
baby
didn't
came.
know,
And
right.
so they asked to develop this class, and, you know, I, of course, was thrilled that they wanted to do it. I'm like,
Yeah.
go for it. We're there for support and education, and that's really the beauty of what we do. And like you said, I think we're one of the best kept secrets. But
Yeah.
Continually, if I have my name tag out in the community, I have people constantly coming up to me and saying, oh, I went to the parenting center. Y'all saved my life. I love you so much. Blah, blah, blah. You know, and
Yeah.
it's like, you know, just warms my soul.
Yeah. And it is a good way for parents and their children to socialize with other parents and children the same age, correct?
Absolutely.
Because a lot of
Absolutely.
these things, most of these things happen in a group setting.
Yes, yes. And we do have a lot of parents that, you know, you can watch them. They'll come in, they might be overwhelmed, not quite sure of what to do and that kind of thing, but it's a very warm and friendly environment. And sometimes, you know, it's hard. A lot of these people
Yeah.
might have been career people yesterday, and today all I have is this little person that doesn't speak, you know.
Yeah, so it's a whole new world.
Just to talk to somebody about what the trials and tribulations that they're going through, the challenges, but also to celebrate the joys.
Yeah. So let's talk about, I know we were talking about with Dr. Fauché Autism Awareness Month is coming up in April, and the Parenting Center is also autism certified.
Yes, we are.
So what does that mean for you at the Parenting Center?
For us, it just built on enhancing some of the things that we already knew. So we don't necessarily do clinical services for children with autism,
Right.
but we do have children with autism that come to the Parenting Center. So just having our staff aware of, again, how to interact with them in a different way.
Right.
But also to look for any signs or symptoms that we might see in some of the children. And we have, just to kind of clue the parents in on, you know, I don't want you to worry, but I do see some things you might want to get checked out.
Right.
And most of our kids are 0 to 5 that come because they're preschoolers is what our population.
Yes.
So that early intervention is just priceless, because the earlier you can start getting some tools to work with your kids, the better.
Right. And so this certification, as Dr. Fauché was saying, it equips you with the tools to know how to interact with a child with sensitivities because of their autistic diagnosis.
Right.
So, but they do the same things as the other children, correct?
Correct. Well, and also to know how to interact with the parents too, because they may have some different things going on with them and challenges.
Yeah.
And so Dr. Sunny McDaniel, and she's on our foundation board, and Yvette Farr is a behavioral analyst. They're both working to even enhance our center more and give us more tools. Dr. Fauché mentioned their video, but also just pictures of different things. We already have pictures of where things go.
Right.
But even a picture story of when you go to the class, this is what you're going to expect.
Yeah.
Well, first we're going to do, you know, the song about our names, and then we're going to do bubbles, and then we're going to do instruments, and we're going to put those away. And so I think that it's going to be a fabulous idea, not just for the autistic children, but for all children, because a lot of times behavior issues are anxiety
Right.
about what's going to happen
New
next.
environment.
I don't know what's going to happen next,
Yeah.
you know. So, and we teach that in some of our parenting, and our parents say that too. It's okay, we have to leave in 5 minutes. You got to give them the warning, because if you just scoop them up and go, they're going to scream and cry. They're not ready yet.
Right.
Just to make those transitions, and also being able to put some of that information and videos on our website so that we can have people see. Of, you know, pictures worth 1,000 words, as they say, and in this case, it's worth more than that.
And speaking of the website, your website, not only does the Parenting Center have a wealth of resources and tips and information, but your website also does. What is the website?
It's sttammany.health.
Okay.
/Parenting Center, if you want to go
Okay.
straight to the Parenting Center. And you can
Perfect.
register for all the classes and such there.
Okay. Well, we don't have a ton of time left, but I do want to mention that the Parenting Center also is a certified car seat safety installer, correct?
Correct.
And also for special needs as
Right.
well.
We are, and we're very happy about that, because we just, in the last year, got our certification and got all our demo seats. So we work with our rehab department for special needs fitting of car seats. And that also could help with the autism with the little escape artist, because we have some information about that too. But before, they had to go to Baton Rouge and New Orleans, and it's usually 3 trips, and it's a long appointment. And so we're happy to be able to bring that service here to the North Shore.
So great. Is there anything else you want to add before we wrap up about the Parenting Center in general, or anything else?
Just that, you know, to know we're here for a resource. We also go out in the community, so we go to churches and schools or groups. If you have any topic that you want to do, we can probably cover it, because I have
deal.
that width of staff and expertise.
Wonderful. Well, thank you so much, Lori, for joining us and giving us this great information. And we're trying to get the word out. Let the secret out of the bag. The Parenting Center is amazing. So we are going to be right back. And when we come back, we're going to be speaking with Melanie Rudolph from our St. Tammany Hospital Foundation. Stay with us.
Any nurse looking to start a career or already working as a nurse and want to advance your career, St. Tammany Health System really is the place to work. We have a great culture here. We collaborate.
It's a small town community feeling. Culture here is about the patient outcome and about the nurses at the bedside. The patient to nurse ratio is on the lower end here, and that enables us to deliver great quality patient care.
I also like the administration here at St. Tammany. I feel like they're very supportive of what nurses have to say, and they really do try their best to make this a great place to work.
It's like a big old family here. We offer great pay, great benefits, and it's like home.
I've been at St. Tammany Health System for 16.5 years, and it's primarily because of the culture, the pay, the benefits, and the opportunities for career and educational advancement.
Welcome back to Healthy Living. Now my guest is Melanie Rudolph. Melanie, thank you so much for joining us. Melanie is a foundation specialist with St. Tammany Hospital Foundation. So I'm excited that you're here.
Thank you for having us. We're
Oh,
thrilled
absolutely.
To be here.
So tell us a little bit about, number one, tell us about yourself. We know Dr. Rob and Lori's a little bit backstory. Tell us about yours.
I have been with St. Tammany Hospital Foundation for 7 years as a foundation specialist. Most of what I do is corporate giving and special events. Thrown in, we're a small but mighty team, so thrown in with a few other fun things like Autism Awareness Month. So love what I do, love our team. Thrilled to be able to support St. Tammany Health System each and every day.
Great, that's good to know. So the foundation itself, as you said, supports St. Tammany Health System. So it directly links itself to St. Tammany Health System and through special events and fundraising events and things like that. And as we all know, as we just talked about a couple of times, April is Autism Awareness Month. So you guys have a special kind of place in your heart for Autism Awareness Month. So tell us a little bit how your support for that started and what it looks like.
At the end of 2020, Dr. McCall McDaniel, who's a pediatric orthopedic surgeon at our bone and joint clinic, came to us because she wanted us to bring this autism certification to St. Tammany Health System. And of course we exist to do the fun stuff and give people the money to do what they want to do. And so over the last 2 years we've been able to certify pretty much all of the pediatrics, inpatient and outpatient, from our pediatrics clinic, which you learned from Dr. Fauché, our parenting center, our pediatric ICU, our emergency department, and we've been thrilled to be able to support them in that way.
And now the Bone and Joint Clinic.
And the Bone and Joint Clinic, of course. And so now that we've been able to do that, we're getting to expand on how we're able to fund that need. And so Lori spoke about the visual aids that we're incorporating, the sensory tools that help a child that's having to go to the emergency room in the middle of the night. Which no kid, that's not fun for any kid, but just the little things that now we can do to make a difference and build on these certifications. And so each April we put on, this will be our 3rd annual Autism Awareness Month campaign. It is led in large part by our foundation board member, Dr. Sonny McDaniel. We sell t-shirts, we do third-party events in the community, and we just encourage our community, one, to show their support for children with autism. And so we like to show that we support them as well. And then also to raise funds for these, each clinic has to be recertified every 2 to 3 years. And so we're able to fund that each and every year. And then all of these extras that add on to the patient care that we're able to provide.
Yeah, and as we talked about with Dr. Fauché and Lori, these certifications equip every person who comes in contact with a family who has an autistic child, the parent, the siblings, everybody. It equips them with the tools they need to interact well with that family and make their child feel comfortable and welcome.
Absolutely.
And safe, really.
Yes, absolutely. So such a great cause, such a great way to support, and we get the wonderful job of being able to share that with our community and help them be a part of it.
Yeah, and the foundation, you guys, this year, what are you doing specifically? You're selling something, right?
We have a few things. We have really great t-shirts. We're super excited about our t-shirts for this year that we'll be selling in the community. Right now, I think we're slated to sell them at a few different locations, which you'll be able to find on our website and, of course, online.
All right.
In addition to that, we'll have some third-party things. We participate each year with Nothing Bundt Cakes. They do a bundt cake pop-up shop at our hospital for us.
Okay, I'm going to have to get the date for that.
We'll be doing one in mid-April that will benefit Autism Awareness Month as well. And this is a good time for me to ping in that Nothing Bundt Cakes will also be receiving an award from our foundation.
Oh, wow.
In May of this year for all of their philanthropic contributions, both in kind and monetary.
That's wonderful.
To our foundation. So
That's
shout
wonderful.
out to Nothing Bundt Cakes. They're good friends to the foundation.
Yeah, so tell us about some other things that the foundation does, because I know this is our focus coming up every year. It's a big focus, Autism Awareness Month. It's vitally important and it's crucial that we do things for Autism Awareness Month. But you also do things for a lot of other causes.
Yes.
And what do those look like? Just kind of throw some things out there.
At the end of April, on April 27th, we'll be hosting our 2nd annual Celebrity Waiter Tailgate Soiree. We partner with the New Orleans chapter of the NFL Players Association, where NFL players wait your table.
Oh, okay.
And so we're
That's a
hosting that
change.
at Benedict's this year, and we call it a great party with a purpose because it supports St. Tammany Cancer Center.
Okay.
And so all of the patient services that we provide there. Lori Cage would be mad at me if I did not mention that we also do Monster Mash each year. She said that the Parenting Center has been in existence for 35 years, and so has Monster Mash.
Oh, that's amazing.
Monster Mash is just a community beloved event.
Right.
And it's going to be hosted on Saturday, October 21st with our wonderful partner, Metairie Bank.
Okay, save the date.
Save the date.
It's
We're
always
ready.
fun.
Bogafly Park, hopefully it's great weather. We have
Right.
4,000 to 5,000 people that come out each year to support the Parenting Center, and it's one of our favorite events that we do each year.
So, what can people do to get involved if they want to get involved with the foundation, or if they just want to give a gift, or how can they get involved with the foundation? How can they learn more?
They can go to our website. It's sthfoundation.org. I always encourage people to call us too. You can call us anytime. It's 985-898-4141.
Right. Okay. And I know that. Tell me a little bit about. We didn't really touch on the healing arts. Can you talk a little bit about that?
That has been such an expansive project. Mary Lee started this effort many, many moons ago, and it has grown so exponentially over the years to fill the walls of our health system and now our cancer center and our outpatient clinics with art. You know, hospitals can be a scary place. We've already talked about that with kids, and it's the same for adults. I don't like going to the doctor.
Right.
And so it's amazing the scientific research that has gone into how very particular things can make a difference in a person's mental scape when they're in a doctor's office or when they're in an exam room in the emergency department. And having the healing lights and the beautiful art, you know, our Healing Arts Committee has worked so hard on lifting up local artists in our community by showcasing their work in our health system.
And we have a deep pool of local artists.
We have a deep, deep pool. One of my favorites is right now on display in the hospital. We have our Reefy project. And so a local artist from here in Mandeville has made these beautiful paper mache 3D reefy fish. I think there's 9 of them right now, and they will eventually be housed permanently in the new pediatric clinic Dr. Fauché mentioned. But that's a fun thing, so you can stop by the hospital anytime and see those.
Those really are fun, and they're just fun, and they're exciting, and they're big. They're big. They're very creative. Well, is there anything else that you want to add about the foundation in general, about Autism Awareness Month? Anything you want someone to come away with before we wrap up?
You know, our mission at the foundation, our health system has grown tremendously over the last 50-ish years that the health system's been in existence, and we're newer to the organization. We've only been around about 20 years, but our goal is to be able to support the facilities, the programs, the physicians, the clinicians, the non-clinicians, every person that is involved with our health system. And so we do everything that we can to support them, and we do everything to encourage our community to support them as well. And so if you're interested in becoming involved as a volunteer, making a gift, attending one of our events, sponsoring one of our events, volunteering at one of our events, we'd certainly love to have you.
Yeah. When you talk about volunteering, what does that involve? Like, what does that look like for someone?
There's so many different ways that you can support. Our Cancer Center has a full volunteer program where you can do things as little as stocking the therapeutic food pantry to being the greeter at the front desk every day. Our Guild is another wonderful resource that we work with each and every day, from working on our new family center to working in the gift shop. You know, there's tons of great ways to be involved in our health system and support better health for our community, which is the end game each and every day.
Right.
So we encourage everybody to get involved in what we do.
Well, I love that we got to talk about this today. Everybody be on the lookout for the t-shirts that will be on sale soon.
Yes.
And nothing but cakes. Well, that'll be for us. And if you want to support the foundation, can you say the website again for us?
sthfoundation.org.
Okay. Well, thank you so much, Melanie,
thank you so much
for
for
joining
having
us.
Thank you.
And thank you for joining us for Healthy Living. And we will see you next time.